imagine any parents will be happy about that. So now, on your first day in medical school, what was it like?
I think it's very exciting. Usually in the first day of medical school, they have this white coat ceremony. And they actually also kind of teach you about the medical oath. So you kind of you start getting into the culture of medicine.
I see. So you study human anatomy, how human body function, bacteria, virus. What do you study?
You know, in medical school, it is a lot of memorization. The first 2 years of medical school, 8 a.m. to 5 p.m., you study anatomy, you study the human body from the microscopic standpoint, then you start studying about diseases. The first 2 years of medical school is just non-stop classroom, non-stop memorization. But I would say that even this ground building phase is very, very important, because it is important for a physician to integrate in between all these chapters and put everything together. And for example, you have to put it together that the hearts, the lungs, the kidneys, the liver, they all work in concert to maintain fluid balance in the body. And when you study in medical school, everything is taught to you chapter by chapter, system by system. But it is up to the person to really integrate all that information together. And that really can separate a great physician from one who is just adequate.
So give us some sense, what is life like in medical school?
I think that for me, the first 2 years of medical school is not much different from college. But hearing from other colleagues who love to party in college, it was a rude awakening. There is really, really no time to play at all. In 4 years of medical school, you're on the go, 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 go.
And what do you talk to each other among the medical students?
I think our conversation would probably be classified as boring, because we do shop talk all the time. So basically it's all about the patients that we have seen in the previous days. And even if it has to do with the grossest of human functions, we carry on our conversations through lunch and dinner.
Wow. Okay, the last 2 years of medical school, what is that like? What was it like?
Very different from the first 2 years of medical school, because now you're in the hospital setting. You're now assigned to a team of physicians. You are at the bottom end of the totem pole, per se. Your responsibility is not great yet, because you're still the students and you're doing a lot of observation. This is during this time, while you are taking in the basics of general surgery, internal medicine, gynecology, pediatrics, you also have to decide what career path you want to go into. So the last 2 years of medical school is important in seeing the different specialties and come to a decision as to where you want to go with your career in medicine.
And you have chosen emergency room as your specialty. What inspired you to make that decision?
For me, I like to continue to treat the whole person. For me, it is not satisfying to treat perhaps just the eye, or the uterus for a gynecologist. Not to denigrate anything about gynecology in any way. I like to treat the whole person, and also I believe in the sacred task of saving someone's life. or having the opportunity to be there to stabilize someone's life when they are in dire need. And emergency medicine is certainly at the forefront of that in terms of the wide fields of medicine.
So now at this point, you had the taste of what a doctor's like, and here come upon the graduation, and first day at work in the emergency room. What came across your mind?
So you're talking about the first experience in residency.
Oh, pardon me, correct. You do have to go. How many years is the residency?
Residency, depending on your specialty, can be between like 3 years to 6 years.
I see.
For emergency medicine, some programs are 3 years, some are 4 years. I went to a 4-year program.
4 years.
Yeah.
How was that like?
If you think that medical school was intense, the residency program is even more intense.
Really?
Because sometime during the residency program, you finally realize that you are the physician. You are no longer just the student. And there will be times when you are called upon to do critical maneuvers. I remember that there was this incident when I was a surgical resident, and I was called emergently to the medical intensive care unit in the middle of the night because someone was dying of a condition that we call pneumothorax, meaning a dangerous buildup of air in the chest. And this person needed a big chest tube placed. And I was extremely nervous because it was only shortly before that I had seen this procedure done once. And with this minimal experience, I am supposed to next actually do this procedure. And I was the only one at the hospital who is supposed to know how to do this procedure. And the end result was very good. I was able to do the procedure, and I think I came off looking well. But in truth, I was probably crapping in my pants.
So that was a happy ending.
That was a happy ending.
Okay, so well, that's exciting. And so now you finished your residency. Time to go to work in an emergency room. What is it like for you in the first day?
Well, I think that I benefit from going to a residency program where we trained at 8 different emergency rooms at different hospitals. I trained at trauma centers. There are county trauma centers, private trauma centers, level 2 trauma centers, private emergency rooms. So I had a good look at which type of situation fits me best. And I chose to work in a community emergency room for my career. I've been there 10 years, and I'm still there.
Yay!
And the first day of work is not much different from the last day of residency. I think it's meant to be that way.
Except the paycheck.
Except the paycheck. Very nice point that you pointed that out.
Well, that